Congratulations! You are pregnant, or you are hoping that you will be soon, but you are curious about what to expect in those critical early weeks. Either way, you are in the right place because that's exactly what we're going to talk about. We are talking about your first trimester, what to expect and what you must know. Hi, I'm Dr. Kady. I am a board certified family clinician. Welcome to HeyDoc. On this channel, we talk all things to do with fertility medicine, pregnancy related matters, and the good old stuff, which is quite simply women's health. If you are new to the channel, welcome, and we are sure that you are going to show us some love by hitting the subscribe button, liking and sharing. And if you are a returning subscriber or a returning viewer, if you are a returning subscriber, thank you so much. Thank you for subscribing. Right, we're cutting to the chase. In this video, I'm going to walk you through everything. We're also going to address other topics like nutrition. So keep watching right through to the end. As it relates to ultrasound scan, in your first trimester, your first ultrasound scan to confirm the pregnancy and to confirm it's within the womb and to also work out an expected date of delivery. It should be done anytime after 8 weeks. The reason we strongly advise that you wait until you are 8 weeks and onwards is because very often if we do it earlier, we don't find a heartbeat and it causes a lot of anxiety for the expecting parents. So if you wait after this time, by that time we should definitely see a heartbeat. And if we don't, it may be a situation of a threatened miscarriage. The fourth area that we must discuss for your first trimester is nutrition. What should you be eating? What should you not be eating? On this channel, I have done a fertility diet video, a video where I talk about what you should be eating when you fall pregnant, what you should try to avoid when you are actively trying to fall pregnant. I will leave a link to it in the description box. Key recommendation: when we talk about nutrition and supplements in the first trimester, it would be almost impossible not to start by talking about prenatal vitamins. Any prenatal vitamin that you choose must contain a minimum of 400 micrograms of folic acid. Why is folic acid so crucial? Is because it prevents neural tube defect. You do not take folic acid, then you are putting your baby at risk of developing a neural tube defect. I don't want to hear it, ladies, in the comment section. I did not take folic acid. My baby is fine. This is just, made belief and it's all about science deceiving women. I don't want to hear it, okay? This is fact that there's been a strong link between children who were born with neural tube defect whose mothers did not take folic acid. You don't want to take folic acid, that's fine. The onus is on you, but this is a scientific evidence that I am forced to share with you as a medical doctor. Your prenatal vitamin should also contain iron and vitamin D. Again, just remembering, I have a video on this channel that talks specifically about prenatal vitamins. What should your prenatal vitamins contain? Go to that video. I'm going to leave a link to it in the description box. Go to that video for a lot more detail. But basically, you need iron. Okay, because the iron that you have as an individual is now going to be shared between yourself and your baby. So often you need to be taking additional iron on top of your prenatal vitamin. If you watch that video, I discuss how to take iron effectively during your antenatal period. It goes without saying, ladies, stay well hydrated. Keeping well hydrated will keep you having a good blood volume and a good supply of nutrient-rich blood to your uterus. Also, for you ladies who are having a terrible time with nausea and vomiting during your pregnancy, it is essential that you eat little bits and often. This has been shown to significantly reduce the experience of nausea. How much caffeine should you take? Limit your intake to 200 milligrams of caffeine a day. I would say maximum 2 cups. If you can, limit it to 1 cup of coffee per day. Avoid fishes that are high in their content of mercury. Avoid unpasteurized dairy, and do not eat any deli meat unless they have been adequately heated. So the next area we're going to cover are the red flags. The things that if they happen, you should worry, that is not normal, is not something that you should tolerate. And in fact, these things, if they happen, I would recommend that you book the next available appointment with your doctor and get seen as soon as possible. So we've got vaginal bleeding. Now, there's two types of vaginal bleeding that can happen in pregnancy. There's the light spotting type of vaginal bleeding that, doesn't cause you much pain. In fact, for many have no pain. It's just a little bit of spotting when you're wiping yourself. Or even if there is cramps, it's mild, it's subtle. And, some women may choose to wear a pad, although they don't have to because it's so light. That's fine. That's not the type of vaginal bleeding for you to worry about. I have another video on this channel that talks about uniquely vaginal spotting, that talks about vaginal bleeding in your pregnancy, which type of vaginal bleeding that there is and what it means and what you should do about it. Again, I will leave a link to that video in the description box. But the type of vaginal bleeding that is a red flag is heavy type of vaginal bleeding, particularly in your first trimester, heavy vaginal bleeding and you're losing clots. Obviously, we worry of a miscarriage. There is also vaginal bleeding, whether it's light or it's heavy, that is associated with significant lower abdominal pain. Those two types of vaginal bleeding, again, I will repeat. The first type is heavy vaginal bleeding. It may or may not be associated with lower abdominal cramp, but that one, you may not have cramps, but it's heavy. We worry of a miscarriage. The second type is light or heavy vaginal bleeding, but you have severe abdominal cramp. For that one, we worry of an ectopic pregnancy. And an ectopic pregnancy is a pregnancy that implants itself outside of the uterine cavity. An ectopic pregnancy is a life-threatening, and heavy vaginal bleeding that occurs in a miscarriage could also be life-threatening if you are losing too much blood. So if you experience these two types of vaginal bleeding, present to the emergency department immediately. So again, severe cramping, if with or without vaginal bleeding. If the cramping is severe, even if you are not bleeding, but you are in a lot of pain, again, we worry about an ectopic pregnancy. Baby planting itself in the wrong place. You may not always bleed, but you are literally belched over in pain. Don't wait. Go to the doctor immediately. High fevers. We don't like pregnancy with high fevers because it means infection, and not just a one-off fever, but fever that is reoccurrent, happens over and over again. We worry, is there infection? Where is this infection coming from? Is this infection of the uterine lining? Particularly if you conceived through IVF and after the embryo transfer, a couple of days later, you're getting lots of fevers. You may be suffering from an infection that has been inserted into the uterine cavity from an infected or contaminated transfer catheter. So get seen as soon as possible if that happens. Persistent vomiting, lady. That means you are not able to keep anything down, or your nausea is so severe that no medication that is being prescribed is actually working, and that you cannot actually eat because all that will happen is that you're vomiting. If that happens and you notice that even drinking is difficult and therefore you've got a reduced urine output, you are clinically dehydrated, and that is termed as hyperemesis gravidarum. Even if the pregnancy is safe, you as the mother, as a carrying mother, you need to be healthy in order to continue to have a healthy pregnancy. You're not able to keep anything down, get yourself to see a doctor immediately. If you've been given one medication and it doesn't work, and you've been switched over to the second medication and it still doesn't work, and you've continued to vomit, and you've certainly gone more than 24 hours without food, you need to take yourself to the hospital. The reason this is important is because you will get fluids through your vessels. You need to have fluid through your vessels in order to keep up your blood volume so that enough nutrient-rich blood is supplied to your uterus. Once you're well hydrated and you're starting to urinate again, and one medication hasn't worked and that's been stopped, the second one has been tried, that hasn't worked again, you now then need to start sitting down with your family clinician and considering whether taking two medications at the same time might be helpful. Again, I have a video on this channel that talks about vomiting in pregnancy, how your doctor should be managing you if you've got heavy, unbearable vomiting in your pregnancy. Now, if you've had symptoms and all of a sudden, like for example, you've had severe nausea and vomiting, you've had lower abdominal cramps, and you've had, all of these pregnancy-like symptoms, and all of a sudden, everything stops. You're not bleeding, you don't have cramps, all of your symptoms have gone. We worry about a miscarriage. If that happens, you need to see your doctor as soon as possible so that you can have an ultrasound scan to confirm the fetus's heartbeat. But please subscribe, guys, if you like what we're doing here and you want to encourage us so that we continue to produce more content like this, and that will be beneficial to yourself, but anyone else that you know who will benefit from what we do right here on Hey Doc. Subscribe, like, share, and tell everyone about Hey Doc. We are grateful for you, and we will see you in our next video. Take care.